The differences between normality and abnormality, a comprehensive exploration in the realms of psychology, sociology, and medicine. The concepts of normality and abnormality are pivotal to understanding human behavior and mental health. While ordinarily perceived as binary opposites, these constructs exist along a continuum shaped by cultural, social, and individual variables. This video is meant to elucidate the intrinsic differences between normality and abnormality, exploring their implications across multiple fields. Defining normality and abnormality. Normality is often characterized by behaviors, thoughts, and feelings that are considered typical or acceptable within a given societal context. It embodies the majority's shared beliefs, customs, and values, thus forming a baseline against which behaviors are measured. The norms that define normality can vary significantly across cultures, communities, and time periods. Descriptors such as common, average, or expected frequently accompany the term, suggesting conformity to social standards. In contrast, abnormality is commonly associated with behaviors or thought patterns that deviate markedly from statistical or social norms. Such deviations may manifest in various forms, including psychological disorders, unusual or eccentric behaviors, and even extreme expressions of emotion. Abnormality can engender stigmatization and may signal distress, dysfunction, or inconsistency with societal expectations, often raising implications for the individual's functioning and mental health. The continuum of mental health. A critical approach to understanding normality and abnormality is through the lens of a continuum, where mental health exists on a spectrum rather than as a static dichotomy. This perspective acknowledges that behaviors traditionally considered normal can fluctuate over time and in response to changing circumstances, while behaviors deemed abnormal may also hold situational validity. For instance, consider anxiety. While a certain level of anxiety is normative, functioning as an adaptive response to threats, excessive anxiety may indicate an anxiety disorder. This disorder, however, can manifest differently based on individual circumstances. Thus, the classification of behavioral responses as normal or abnormal becomes context-dependent, often requiring nuanced assessment. Cultural influences on normality and abnormality. Cultural context plays a significant role in shaping definitions of normality and abnormality. What may be considered a normative behavior in one culture could be perceived as abnormal in another. For example, practices such as communal grieving, expressive emoting, or specific rituals defined by a cultural context may seem unusual when viewed through the lens of another culture. This cultural relativism underscores the importance of considering societal values and historical contexts when evaluating behavior. Mental health professionals are increasingly recognizing the impact of cultural backgrounds in assessments and interventions. The Diagnostic and Statistical Manual of Mental Disorders, DSM, acknowledges these variances, encouraging clinicians to consider cultural factors when diagnosing mental health conditions. Psychological perspectives. The psychological community engages with the concepts of normality and abnormality through various theoretical frameworks. The biomedical model, for instance, often emphasizes biological factors and relies on the categorization of symptoms to diagnose mental disorders. Here, abnormality is framed in terms of pathology, with clear demarcations drawn around established mental health conditions. In contrast, the psychodynamic perspective focuses on unconscious processes and the influence of early experiences, which may dilute strict definitions of normality and abnormality. This approach identifies a range of behaviors driven by psychological mechanisms, exhibiting how elements of both can exist within individuals. Further, the humanistic approach, championed by thinkers such as Carl Rogers and Abraham Maslow, prioritizes individual experience, emphasizing personal growth and self-actualization. From this perspective, normality is identified as the pursuit of fulfillment and meaning, while abnormality may signify barriers to such growth, rather than an inherent flaw in behavior. The clinical implications. The distinction between normality and abnormality carries profound clinical implications. Mental health practitioners harness these concepts to develop therapeutic interventions, perform assessments, and tailor treatment plans. Accurate diagnosis is crucial, as it informs the types of interventions that may be effective and the resources required for optimal mental health outcomes. However, the stigmatization of abnormal behavior can complicate this process. Individuals may fear seeking help due to societal labels associated with mental illness, potentially exacerbating their conditions. This reality underscores the necessity for educational outreach and destigmatization initiatives, fostering environments wherein individuals feel empowered to seek care without fear of judgment. Ethical considerations. Delving into the realms of normality and abnormality necessitates a sensitivity to ethical considerations. Diagnostic criteria, cultural perceptions, and the implications for individual identity are all critical factors. The potential for harm resulting from misdiagnosis or overly simplistic categorizations serves as a reminder of the responsibility mental health professionals have towards their clients. Moreover, the intersection of normality and abnormality raises philosophical questions regarding the nature of human experience itself. In an increasingly diverse world, understanding the spectrum of human behavior as a complex interplay of emotional, psychological, and contextual factors may lead to broader acceptance of individual differences. Conclusion. Ultimately, the distinctions between normality and abnormality erase the simplicity of a binary classification, revealing a rich tapestry woven from cultural, psychological, and individual threads. Understanding these differences is essential for mental health professionals, educators, and society at large, as they navigate the complexities inherent in human behavior. Recognizing that notions of normality and abnormality are fluid and context-dependent permits a more compassionate and inclusive approach to mental health. In doing so, we move closer to a society that embraces diversity and promotes well-being for all its members, thus enriching the human experience in its multifaceted forms.